thanks for sticking here through post-lunch. I'm Shaddy Saba. I am a doctoral candidate at the USC School of Social Work, and I'm going to be talking to you about some of our work predicting trajectories of hazardous drinking among military veterans. So hazardous drinking is defined as drinking that puts somebody at risk of negative health or social consequences. So by definition, kind of a, something people want to avoid. But prevalence among veterans, military veterans, is really, really high, with some epidemiological work suggesting lifetime prevalence as high as 40%. And among people that have suffered or have had hazardous drinking, many folks, recover either naturally or through treatment, but many people don't recover or have a really hard time recovering. So there's some heterogeneity. And when we want to think about why that might be the case, I personally like to look to models like these. I think this is common in social work and in the health sciences generally. The biopsychosocial model, which suggests these are really complex problems with a range of determinants. And so, among veterans, this is really relevant because veterans have had really challenging physical experiences that might lead to mental health problems, and such mental health problems might influence drinking, as well as like injuries and things like that. And we know that among populations, veteran populations, like many other populations, kind of social determinants interact with many of those things. So things like poverty, area level factors, for example. And so the research question that we have is, what are the, thinking back to that really complex model, what are the things that most affect the course of hazardous drinking among veterans? And then when we think about that model, it's maybe hard to tease out like what's most important, and then how do these factors kind of interact with one another. So the data source for this study is a 2-year cohort study led by Dr. Davis and Dr. Eric Peterson. We recruited over 1,200 veterans, and this study involves a subset of those that met criteria for hazardous drinking, surveyed 6 times over 2 years. And like I said, we want to start to get at what are the predictors of how people do over 2 years, sort of the course of hazardous drinking. And the characteristics in terms of demographics are pretty standard for military veterans of this age. So, really highly skewed male and white. In terms of individual level predictors, we had a lot of things in the study survey that was administered. And so again, thinking back to that biopsychosocial model, all these things you can make a case for either theoretically or empirically for including in like as we think about, what might drive or contribute to or explain associations. So things like demographics, military experiences, branch, post-traumatic stress disorder, psychological problems, et cetera. And then we also were able to access, based on participant zip codes, a bunch of area level predictors, or potential predictors, I should say. So kind of area level disadvantage from the US Census. These data sets called the Opportunity Atlas and Social Capital Atlas are really, really rich data sets that have to do with how folks may have access to economic mobility and job growth and things like that. And then I was able to access VA wait time search, to get at how do people, what kind of access do people have to healthcare services. And the modeling strategy that we use in this study is it's called structural equation modeling forests, and it merges one of the modeling families that we use a lot in the social sciences known as structural equation modeling. And in a kind of nutshell, that allows us to model hazardous, the trajectory, so intercept and slope for the sample. And then SEM trees, or structural equation modeling trees, allows us to partition the sample into subgroups based on predictors. And then forest is kind of MCM forest is an ensemble method, combining thousands of trees potentially, and to help us get at what are the most robust and important predictors. And so with that modeling approach, these were the top ranked predictors of the ones that we included in our models. And I'm going to kind of take these top 3. So, anxiety, post-traumatic stress disorder, and a kind of combat experience called moral injury, which is when somebody has an experience that sort of messes with their sense of their own or other people's morality. And so you can kind of imagine why that might be something that military veterans face. And so might be challenging to see this with the color, but basically that top trajectory is folks with all three that kind of meet criteria for all three of those things. The bottom line is folks that don't have any of those three. And then what's really interesting is that green line that starts near the top, but kind of diverges from the top line where people just have anxiety and PTSD. And that kind of tells us that perhaps there's kind of a cumulative risk going on where folks that have both challenging combat experiences and difficult symptomology may be at most risk. And so when you're a program, running a program, or you're a clinician, models like these can help us maybe start to untangle potential risk factors and think about the most important ones. And ultimately, we can, this kind of modeling is probably broadly applicable in helping us to start to get at more hypothesis centered and driven research. And so, yeah, that's all I got.